Thank you, Jeff. He's my new boss. I'm really pleased to be here today because, as Jeff said, this is a journey that began some time ago and is the culmination of an extraordinary amount of collaborative effort that involves not only our clinicians, but every member of the UW family, every member of the community that we serve, and hopefully will achieve all of the objectives that Jeff pointed out for a building in front of us. It's an incredible testimony to the fact that good planning actually delivers outstanding results. I would be remiss if I didn't point out that recently UW Health was identified as the top hospital in Wisconsin for the 4th year running, and I believe that this facility will just continue to be a part of a system of care that is recognized as preeminent in Wisconsin and our region for many years to come. I'm proud of the recognition that we get through those kind of events, but I'm mostly proud of the way that our staff and our patients interact in terms of clinical care and the outcomes that we're able to achieve as a health system. We're never satisfied with the way that we do things, and we're always striving to do things in a way that can improve the care experience for those that we serve, and this facility really was gestated on those principles. It's no surprise that 10 years ago, UW Health leaders acquired land here in the American Family Center Park with the vision that the east side of Madison and the referral markets that we serve, primarily in Rockford and in the Fox Valley, would be best served by having UW facilities on this side of town. This site laid fallow. It was in cornfields for many years, and when I joined UW Health in 2009, one of my initial challenges that Dr. Grossman and at the time Donna Kate Mahensky gave me was to begin the planning process for realization of having a healthcare facility on the east side of Madison. As Jeff pointed out, that commitment was founded in our desire to be patient and family centered in every aspect of care that we deliver, and having our patient and family advisors here with us today is really a culmination of a long journey. They've been involved with the design of this project for over 3 years now, 4 years now, from its very inception, from building tiny little models with cardboard and masking tape to full-sized mock-ups of the rooms that you will be touring in later today. And it's really wonderful to see them here enjoying the fruits of their labor. The plan that we have here is to, as Jeff pointed out, have a place where people can have planned surgeries that don't require the very specialized capabilities of the main hospital campus, but it still provides state-of-the-art care. It's an environment that we feel is easier to navigate. It's designed around patient needs and to bring the care teams together in ways that they've never been able to work together in facilities that didn't take into account modern medical practice. The maximum collaboration that is allowed by staff here is expressed in a number of outstanding architectural features, including our common workspaces that, working closely with Vlad and our architect firms, were able to realize. And I would point out that this is the first facility from its complete inception that's been built with lean design principles. And lean design principles involve processes that we call the 3P process: production, preparation, process, planning. And it meant bringing together these teams of people and devoting them to designing the perfect environment for the delivery of care and not for any other purpose. If you go through the building, you'll notice that about 2/3 of the space is devoted to outpatient care, and a lot of the spaces are geared towards helping people stay healthy. So we do believe that this is a community resource where we expect and invite the community to participate with us in terms of cooking classes, fitness programs, meeting spaces. This is not just a place for sick people to come to get care. This is a place for people to interact with the healthcare system in a way that can keep them healthy for a long time. In the summer and fall of 2012, we gathered these groups of physicians, staff members, patients, and others start the design of this building. And it's easy to get very focused here on the end product, but it's really quite astounding in terms of how well that planning process worked. And I want to take a moment right now to recognize some of the people, and one person in particular who was fundamental in getting that process going. From the development of what we call the spa, which was a floor of the children's hospital that we totally took over for our purposes and needs for about a year and a half, to unbelievable amounts of subgroup meetings and process improvement meetings, none of which would have happened except for the stewardship of Mark Hamilton. Is Mark here today? You know, it's sometimes hard to hand over a process to other people. Mark was so fundamental in terms of the planning of this facility and bringing these care teams together. And then we recruited Ralph Turner to help build this facility. We recruited John Sheehan to ultimately be the operating manager. But the seeds of this great facility were laid with that planning process. And if Mark would come up here, I'd just like to give him a small token of appreciation, which is a framed picture of the American Center with a plaque on it. Just You know, I've had the pleasure in my career to see 3 or 4 hospital projects go from bare ground to completion, and none has been as exciting as this project has been. And it really does take a team of people to bring this into reality. And next I'd like to introduce my colleague, Ralph Turner, who is our Vice President for Facilities and Support Services. Ralph came to us from the U.S. Army with a great deal of experience in facilities and project management. But he, in concert with our architects and our builders, have executed an outstanding facility based on all of the good work that went into the planning process. So I'd like Ralph to talk a little bit about how this vision was translated into reality. Thanks so much for coming today. Enjoy the tour.